The first day of school is coming up soon for some of our local school districts, and there are concerns about low vaccination rates and on the rise in young children across the country.
One of the common vaccines for young children is for whooping cough, which kids are more prone to catching during fall and winter months. Fox 23's Jade Morrow is live in the newsroom. Jade, you talked to a pediatrician about the dangers of whooping cough and the issues it could cause in the long run.
That's right, Shay. Whooping cough commonly infects infants ages 2 months or younger, but anyone of any age can get it. If they're not treated or vaccinated, it can lead to life-altering altercations or worse, death. Pertussis, otherwise known as whooping cough, is a respiratory infection that is common in young children and is what Dr. Jeffrey Rice, a St. Francis Children's Physician's pediatrician, says is one of the most dangerous diseases.
It starts off as a very benign, very seemingly innocent viral illness. You're starting with a cough, and then before you know it, you're coughing harder, and you get what's called a paroxysmal cough.
Children diagnosed with whooping cough can lose their breath, have apnea spells, or throw up. Dr. Rice says this disease is common with young children, but anyone can catch it, adults included.
Somebody that's barely learning how to breathe already, and then they can't get protected, and so they're even more at risk for it. And then the older population is also at risk for it.
So anyone's at risk for it?
Anybody's at risk.
But those who are not vaccinated are more at risk.
The worst parts are probably the youngest babies, the unvaccinated populations, and patients with critical illnesses or other illnesses that go along with things.
The CDC has seen its third breaking record year in a row in the nation for the exemption rate for vaccinations like whooping cough. According to their research, the fraction of kids exempted from vaccination requirements rose from 3.7% the previous year to 4.1% this year. The majority of those exemptions being parents withholding vaccines for non-medical reasons.
There are things like religious exemptions and exception forms. Those are becoming more popular as there's become more vaccine hesitancy. In just the general population and with various misinformation being spread.
Dr. Rice says they have open conversations about the risk and rewards of vaccinations on a regular basis with families who are on the fence about having their child vaccinated.
Come in and talk to us. Let me have a conversation with you about, what vaccines are and why we do so many of them. A lot of people, really get worried because there's so many more today than there was, in the 80s and the 90s. But there's reasons for that.
Dr. Rice understands some families may have their reasons as to why they don't want their child to be vaccinated. But diseases like whooping cough are deadly.
If we can prevent one kid's death by giving the vaccine, we've done our job. If we can prevent, a whole population, a whole generation from dying from something that an older generation used to experience and pass away from on a regular basis at a younger age, that's awesome. And that's what we're trying to do.
Dr. Rice says it is highly recommended for children aged 2 months old to have the vaccination for whooping cough and to continue to get boosters as a form of protection. Live in the newsroom covering News That Matters, I'm Jade Morrow, Fox 23 News.
The Oklahoma State Department of Health has a guide on the immunizations required for the upcoming school year, depending on the grade your child is entering. We have that posted in this story on fox23.com and the free Fox 23 News app.